My doctor had said that people, my internist, he had said that some patients that they've done so well, lost weight, gotten better with their blood sugar, he's been able to take them off the medicines. But like you said, when you have diabetes, you'll always have it.
Yeah. It doesn't go away.
It doesn't go away.
No. And diet, we use it with every patient in every step of the therapy. But we always add medication. We don't treat only by diet. I have only one patient in my 11-year practice. One patient who did that. One. And believe me, I have thousands of diabetic patients.
The way he was talking.
Nobody can do it.
Really? He didn't say that, if he takes them off the medicine, that the diabetes has gone away. That's what I was thinking.
No, it doesn't go away.
You always
No.
have it.
You have it, but will be controlled.
Okay. And have you ever heard of the Herbalife weight loss program?
No.
No, because
I have no comments on this because I don't know. See, it's the amount of calories you eat. It's not really what kind of diet you follow. Yes.
Okay.
I can make a comment on.
Oh, because she knows.
Yeah.
Because I did see a client that was taking that before she came for diabetes education. It's very costly, and her blood sugar numbers were all out of control. So she came in our program, she agreed to stop doing that, save money, and she's a dietitian is part of our education program. And so the dietitian advised her on a healthy diet, watching her carb intake and making sure she gets enough carbs, your fuel source, but not too many. And along with diabetes management and the correct medications, her blood sugars are under control, so she's much happier.
I mean, why patient gain weight? It's very simple math. What goes in and goes out, right? If the in more than the out, fat will develop and you will gain weight. If the out more than the in, you will lose weight. So it's a balance. So basically, eat less, exercise more. So you will have negative balance. So that negative will come from your fat to compensate. You will lose weight. There is no specific diet but another. Any diet you like is good as long as more balanced diet. Don't waste your money on anything. Go and enjoy your life. Healthy style. Eat less so you can have a negative balance so you can lose some calories. That's it. You save money, you'll be okay, you'll be healthy, and that's it. Yes.
Question, can having a thyroid condition complicate or mess with the diabetes?
No, but they can come together. That's why I do screening tests with thyroid every time with diabetic patients.
Because I have both.
I don't have diabetes, but my dad does. He's in his late 80s, and
Okay.
he just, he's going to be coming back home, and I don't know, he's been hospitalized for like the last 6 weeks. He had a problem with his foot, but he'll be coming back home. How, I don't know if he'll be able to keep giving himself insulin. Are most people, even when they're elderly, are they still able to give themselves insulin?
And almost everybody can do it. But they have to have some physical power to do it, or the mentality, or
Right,
they have to know what to do.
Right.
But everybody can do it. I have, when I was doing pediatrics a while ago, 5-6-year-old, they can do it. It's nothing really difficult to do it.
I mean, he's been doing it for years, but I'm just wondering after he comes home,
I'm almost sure he could do it.
he could.
Probably, most likely.
Okay.
Yeah.
Because I was
Unless he's mentally not there and physically not there, but he
Yeah,
can.
no, that,
I have patient 95-year-old doing it, so.
I think we've just been taught, kind of like what you said, because I think even with my dad and trying to deal with my dad with his insulin, I think there was always this threat of, if you don't get it under control, you're going to have to go on insulin. So then you always thought you were a bad.
Yeah, that's the problem. We scare people with insulin, so they like, because what happens when I have patients, tell them, okay, you're being insulin, oh, I'm going to die.
Yeah.
Because they always keep insulin at the end, and then they'll, oh, my cousin took the insulin, and then after a few months she died, or he died, or whatever. It's not really from the insulin, it's not because they took insulin too late.
Yes.
And but the time they start taking insulin, it was too late. Insulin is your lifesaver because your body has insulin, you're producing insulin, we're not doing something different. We just give it to you to bring your sugar. Now, why we cannot give insulin in that oral form is protein. So if you take a protein in the mouth, the stomach will destroy it. So that's why you cannot take it other than injection. They try the inhaler, but it caused some lung problems, so they stopped doing it. So the easy way is an injection because you cannot swallow it. It's like, the egg. When you boil the egg, you boil it, you add some acid, it will just change. The protein will be damaged and become thick. The same thing with insulin. It's a protein. You cannot give it orally. It has to be injection. Had a question?
So Actos and glipizide, they're not insulin. They
No.
are, what is it that they are supposed to?
Glipizide make you produce more insulin. It just push your pancreas to work more. Actos, it make you use your own insulin in a better way.
Okay. I've had a lot of side effects with both of those medications, to the point that I don't feel good, that I've gained more weight, that
Actos, you will gain weight, yes.
that I don't want to move, I don't want to do anything, and I'm like, that,
So go to metformin, go to Victoza, you lose some weight. Go to Byetta, you lose some weight.
I
Insulin.
metformin to begin with and had an adverse reaction to that also.
May I ask what side effects you had?
I don't really want to say.
I know what you mean. That's why I ask. You see, there is different formulation of metformin. You take the brand name, extended release, and start low and go up slowly. Most of the time, you will not have this problem. Just be patient. Don't rush to take the maximum dose within a day or two. Give it a few weeks. You will do it easily. And then there is a brand name drugs, metformin, you can take. The side effects almost 95-96% less than the generic metformin, but way more expensive. That one costs $0. That one costs $150. Plus, diabetes is expensive. So, once you have diabetes, as if you are shopping in Michigan Avenue in Chicago, that's it. Everything is so expensive. There's no generics except 1 or 2 drugs, and that's it. So make sure you have good insurance. Always. And don't buy cheap insurance, even if you pay more copay or whatever. Good insurance, because it's a very expensive disease. Between doctor visits, blood work, medication, it will come a lot.
How often do you think patients should see their physician?
It depends. If they are controlled, I see them 2-3 times a year. Because we know seeing them 3 times have better outcome than seeing them 1 or 2 times. It's proven by research. So, because they get scared from the doctors. So, well, at least that's what we think.
Do you recommend cholesterol medicine also?
Always. Always. If you are older than 40, there is guideline we have to follow. If you are older than 40, cholesterol drug always, a statin, aspirin, medication to bring your sugar down, medication to make your blood pressure goes down. No, I have many patients, they come, they take only 1 drug, they leave home with 10 prescriptions. Sometimes I do it over 2 visits, sometimes I give it once, I cannot wait. But that's what we need to take, so.
So like my doctor who requires me to come in every 3 months for blood work, that would be,
Yeah, it depends. If your sugar is really well controlled, every 4 months should be fine. But if not controlled, some of them I see them every week or 2, just to bring their sugar down, then I become less frequent.
Did you say you would see patients with 1 medication and they would end up with 10? Or did you?
Sometimes I have that, yes. Because they come to me, they take only 1 drug for sugar, not controlled, so I give them more than 1 drug for sugar, 1 or 2 for cholesterol, 1 or 2 or 3 for diabetes, for high blood pressure, and aspirin. Maybe they have some diabetic neuropathy, another drug or 2, and you add up. So, because you have to take a cholesterol drug, you have to. Even if your cholesterol is 60, 70, you have to take something. That's the guidelines. You have to take an aspirin if you are older than 40. And you need to take sugar medication. And usually your blood pressure is high most of the time. So you need some blood pressure medication. And you hardly see someone take 1 drug for blood pressure, either 2 or 3. I have almost nobody take 1 drug for blood pressure. Most of them, they need 2 or more. Most of them. And the same thing with diabetes. Most of them, they need more than 1. And at least 1 statin, plus maybe other medication for cholesterol.
I've been kind of.
So, the secret here is lose weight, prevent the disease, take control early. It makes a big difference in your life. So if you lose 10% of your weight, half of these drugs will disappear. Your blood pressure medication will go down in half or none. You will take 1 drug for cholesterol, 1 or 2 drugs for sugar, and you will be fine. Just by some weight loss. And I mean it. And I see it every day. And you can't imagine how many patients, when put them on good diet, they follow their recommendation, their insulin dose goes in half, even less than half, a lot, because they were eating so much, so they were requiring so much medication. Once they control their diet, their dose goes in half. She called me every day, this patient's sugar is getting low now, what we should do.
Is it typical? I guess this is what I'm fighting. I'm having a terrible time trying to lose the weight. And my doctor said, okay, I want you journaling for the next 3 months what you're eating. Because she was sure I was doing like 1,500 to 2,000 calories a day. Well, I'm doing like 1,100 calories a day. And she was quite sure that I had to be doing more. And I said, no, this is what I'm doing. Is there something besides just your food intake? You know, if
Did they check your thyroid?
Well, see, and this is the issue with my thyroid. My thyroid keeps checking out normal.
Well, normal is normal, that's it.
But what I said to her is I keep gaining weight. So she actually went through and did a nuclear test and a, what do you call it?
Ultrasound?
Yes.
What make a difference?
And my blood work says normal, but my thyroid is only working at 6%.
From what?
From what?
6%. How do you know 6%?
Well, that's what she told me. She said,
From the scan doesn't mean anything.
okay.
The test is more accurate in the blood.
Okay.
See, normal thyroid is less than 30% working.
Okay.
If your thyroid goes over 30%, that's too much.
Okay.
So 6% with a normal thyroid test is normal.
Okay.
So your weight is not your thyroid. You need to exercise.
Okay.
And ask your doctor to give you some medication we give for diabetics, help you to lose weight also.
Okay.
There is some in the market like Victoza or Byetta.
Okay.
People lose weight.
Okay.
And probably if you take that, you won't need the insulin even.
Okay.
That's my guess. And you lose some weight.
Okay.
And you take Actos. Actos make you gain weight.
Yeah, that's what she said. She
That's
said
another
I think
thing.
you off of that.
Sometimes this little bit of manipulation of the drugs make people lose weight, make them happy and exercise. Even if you eat 1,100, maybe this is too much even for you as a person.
Okay.
Spread them 5 times a day and exercise. Because many patients, they starve all day long and then they eat a big dinner. That's not good. 5 meals a day.
Okay.
Divide 1,100 5 times. Breakfast, snack, lunch, snack, and dinner, and maybe another snack if you want. It will have better than eating one a day, right?
So are you giving the Byetta and the insulin? Along with the insulin?
You see, it's not FDA approved to give both together. By the FDA, it's not approved.
Yeah, because it's not insulin.
But do I give it? Yes. I have hundreds of patients on it. But it's not approved by the FDA. And I explain to my patients. But in her case, probably I don't think so she will need even the insulin. Just switching her to that should be fine. You see, if you take insulin like 30, 40, 50 units, you can switch, would be no problem.
Yeah, 'cause I take
Usually, not everybody. A few more minutes. And I love Byetta, I love Victoza, they're good drugs. All the drugs are good, except
Well, I just wondered.
the sulfonylurea, I don't like them.
That, you know, that you would take somebody off insulin and put them on the
Yeah.
Byetta.
I switch all the time. See, diabetes management is a bit an art because there is too many medication in the market,
Yeah.
which is the best.
Individualized.
Yes, everybody is a little bit individualized, but there are certain guidelines we follow. Certain drugs you cannot mix, and so on. But try exercise and you will see the difference, I guarantee you. Walk 15 minutes after you eat, lunch and dinner.
Because mostly what I'm doing right now is swimming and bicycling, so.
And go up with the insulin. Any questions? No? Okay.
Thank you.
You're welcome.